Damila, good morning once again. Today, we will go look into the level three qualification in health and social care. And the unit we'll be looking at is a structure and overview of the health and social care sector. I mean, how does it function? What are the components and the units that comes under the structure of the health and social care? It's quite broad, but we hope to narrow it and tackle quite essential areas that will be of benefit to learners and students who intend to take this course. Okay, so the course structure comes in a credit value which may either be a pass merit or a distinction. And what we seek to achieve is to sort of bring to the understanding of the learner to be able, you can mute yourself if there's any noise at the background. Okay, are you there, Damilola? Damilola, are you there?
Yes, I am here.
Okay. So there are learning outcomes that we hope to meet per the awarding body qualifications and how learners need to get some of this understanding. And then there are assessment criteria for which we expect that learners would do justice to assignment summations, making sure that they are meeting learning outcomes. So one of those is, and unit one, which we trying to dive into today, is to bring to understanding the structure of the health and social care. One, to explain the aims and health and social care. Two, to describe the organizational health and social care provision within your chosen country. Obviously, UK is a chosen country. And then three, to describe the size of the health and social care sector within your chosen country. Four, to explain how the health and social care sector provision um, function or how it's funded. So those are four things that we have to look into. Like I said, it depends on how you present your assignment, that would determine whether you fall into a pass merit, a merit, or a distinction. A merit where you are being able to explain in more detail when the questions are being asked, and then distinction when you have a bit of um, supporting evidences in your past and merit submissions. You add a bit more flesh to what you submitted that enables you to get a distinction grade. Obviously, you know about references and all those that you need to provide that helps you in getting your distinctions and all that. So today we are going to look into the unit one, which is health and social care, and the structure that comes with it. What are the structures? Which bodies comes under the NA, under the health and social care? We have the health and social care. We have the social care, the funding part. We have the NHS, and so we have to look into the various components that falls under the healthcare sector and the provision that it comes with, where it's private funding, whether it's government funding, and all that. Do you understand me, please? Do you understand me?
Yes.
Okay, that's fine. 1 minute. So can you see the screen? Can you see the screen, Amina?
Yes, I can.
Okay. So, like I mentioned, we aim to develop a study of the social care, the aims and purposes, and the organization that provide health and social care, along with awareness of current issues impacting the healthcare sector. Are you a carer? Amina, are you a carer, please?
No.
You're not. So are you new in care?
I'm just doing the program so I can join care.
Okay, that's fine. So just 1 minute. Somebody wants to join. Just 1 minute. Just 1 minute. Okay, so the NHS is divided into a primary care, what we call primary care, secondary care, and then tertiary care. Are we? Can we unmute ourselves, please? Hello. Those of us who have joined, can you put up your full name on the message group for me, please?
Sorry, say that again. Good morning.
Those who have just joined, could you put your full name on the message group for me, please?
Okay.
You have about 13 people. Could you all put your names on, apart from Damaniloa?
Damilola.
And I need your videos on those who have joined. I'm sorry, I said full names and not first names, please. Full names. Victor, could I have your full name, please? Alice, I need your full name, please. Who else, please? Yeah, so we have 11 people now. I have about only 5 names on. Adebisi, Ali, could you put your full name on? Esther Jomoti, can I have your full name? Is it Mahima Korakwa? iPhone, could you read me? We need your full name, please.
I already sent in my full name, Osama Fletch for Yanova House.
So you are iPhone, please.
Yes.
Okay. And as a matter of rules, could I have your videos turned on briefly? Please, videos turn on briefly, please. Okay. So I hope you could all hear my voice. Can you?
Yes.
I hope you could all hear my voice. Can you?
Yes.
Good. So let's have an interaction session. Should you have any questions, you could message on the group, or you could give a sign up with the raise up thumb, and then questions could be asked along the line. Feel free to draw my attention should you need any clarity or should you need any question to ask, and I'm more than willing to stop and answer questions, but then it should be done in an orderly manner. Either you send a message or you prompt me, and then I could recap or I could explain in detail. Now, you've just joined, and so apart from Damilola, I'll just recap quickly. I did mention that today is a level 3 qualification in health and social care, unit 1, and we expect that learners, either carers or non-carers, to come to understanding of the course that they are undertaking and to be able to understand the health and social care structure very well, which has different functions and components within the health and social care. So the structure which we have explained has what we call unit 1, which has 1.1, 1.3, and then 1.4. And these structures, in your understanding, you're expected to have some kind of assignment where you would submit assignment to reflect what you have understood. And these assignments will determine whether you fall under a pass mark student or a distinction student or a merit student. And when we say pass, it means that they are learning outcomes that we expect that learners should be able to meet. And therefore, if your submissions do not meet those criteria assessment that assesses, or for us teachers assess you, then you fall under a pass marks. But then if you want to get a merit mark, then you should be able to explain in detail when questions are being posed to you, so you can give more informed understanding to the tutor or the assessor that you are not a level, just a normal student, but then you have read and giving more detailed information. And then distinction, when you be able to give more practical examples to what you have done or your submissions, and those would help you in achieving. Don't forget, you have your references to support that anything that you don't support with the references, then you might be cited for plagiarism, and you cannot even have a pass mark. So there are a few things that you need to know. I'm sure you've had your lectures on that, as to your font size, as to your submissions, as to how you answer the questions and all that. So let's do justice to today's lectures. I did mention before you join that there are components that comes under the health and social care, and one of those is the NHS. Okay, and I'm sure many of you who live in the UK have heard about the NHS. I'm sure you all live in the UK, don't you? And
Yes.
so
Yes.
good. So one of those thing we're looking at is the NHS, and the NHS has various functions and components that learners would have. We have the primary care, and then the secondary care, and then we have the tertiary care. Okay. The primary care is the first point of contact where people who are in need in the healthcare sector are usually provided by professionals as the GPs that we know, the dentists, the pharmacists. NHS England, which the new government, the Labour government, is proposing to change into the healthcare services. I'm sure many of you have heard about it, haven't you? Okay, so they're trying to scrap the name to its original name before, which is healthcare services. It provides care free at point of service. So we all know that when we are sick in the UK, our first point of contact is our GP. So this is what we call primary care, or the GP may refer you to a pharmacist after assessing you and then giving you medication. They would expect you to pick up your medication from the pharmacist. That is what we call the primary care. It's the first point of care when it comes to the NHS. Then you have the secondary care, which normally refers to hospitals and community care. You are much aware that when you are being assessed by the GP, either they have to send you to a pharmacist if your ailment is not too sort of engaging or serious, then they would have to refer you to a pharmacist by giving a medication for you to pick up. But then if it's quite serious ailment and something that has to go beyond pharmacies, then they would have to further refer you to an hospital, or sometimes they would say go to an A&E for such treatment. And that's what we call secondary care. Okay, that's what we call secondary care. And then the tertiary care is where it involves beyond just going to an A&E or an hospital, but then it needs a specialized training, a treatment where you might have to be referred to a surgery, or they need further scan or radioactive scans on you to, to foresee or to tell what kind of ailment is causing the underlying factors in your situation. And that may be it may involve transplant, it may involve forensic checks and all of that. So these are the explanations when we talk about primary care, secondary care, and tertiary care within the NHS function. Okay, are we together? Are we together?
Yes.
Any questions? Okay, let's move on. So, what then describe the healthcare provision? It's a kind of provision that describes the entire healthcare areas, whether inpatient or outpatient care. In the UK, we have what we call inpatient, outpatient. And so the hospital have outpatients or the inpatient. So inpatient when you are being admitted into a proper ward, and outpatient when you are not in a proper ward, when you are outside the ward. So A&E and all that is outpatient. Then, but if once you are admitted, whilst they feel that your ailment is serious, for that, a doctor will have to admit and write or recommend that you are being further admitted into the ward for further treatment. That is inpatient. Okay, so it involves nursing services, medication, rehabilitations, and these are all healthcare provisions. So it's quite broad when we talk about healthcare provisions. Okay, it involves anything, transportation, ambulance, they all fall under healthcare. However, when we say social care provisions, it's quite different from healthcare provisions, where social care provisions are more to provide learning, support to people with learning disabilities. So what we do at home, domiciliary care, those are social care provisions, having to attend the homes of ill service users and sick people. Those are what we call social care provisions. So the healthcare provision is quite different. The healthcare provisions involve hospitals and outpatients and all that. But the social care provisions are quite different when it comes to that. Okay, just bear with me. That very involving when it comes to that. So that is what we call domiciliary care. When we say domiciliary care, when we say physical disabilities, mental health, support that comes over practical activities, personal care. And so what we seek to explain is, while the healthcare provisions describes the quite broader part of healthcare, which involves medication and all sort of patients and outpatients. Social care provisions are quite different. Social care looks into what we call person-centered care, where it's more to do with the taking care of people in their own way as they want. And one of them is what we call domiciliary care or supported living. Okay, because with that you attend the homes of the people and you give them care at your own comfort, where social care provisions is not like that. Okay, So it involves personal care, it involves social care. Of course, before a patient is given a place to be taken care of from their homes, a social carer will have to do what we call risk assessments within the home to be able to foresee whether there will be problems or not, and how many carers would have to be assigned to take care of the person. Okay. Right. It also has a component of promoting well-being, because well-being is all we seek to do when it comes to care. Okay. Well-being is well. So promoting well-being involves actively seeking improvement in aspects of well-being when carrying out care and support. A function in relation to an individual at any stage or process, from the provision of information and advice to reviewing a care and support plan. Well-being should be the components in your day-to-day activity as a carer. All you seek to do is to ensure that you become part and parcel of the process of recovery for patients that you have been assigned for, whether in the hospital as a support worker or whether in the home as a social worker. Okay, it is your main duty is to ensure that you are able to form part of the recovering team in ensuring that the patient becomes independent and well taken after. Okay, all right. So well-being would have different definition, okay, as captured in here. Personal dignity, I've mentioned physical and mental health, well-being, protection against abuse and neglect. These are all responsibilities of carers. And at a level 3 qualification, you should be able to understand all the types of abuse, and the severity of abuse, physical abuse, emotional abuse, all those. You are there to prevent the service user or the patient to undergo all these things, to help them. Where you see any issue that raises concerns, then you will need to sort of bring to the attention of your line manager or the nurse you work with or whoever is around you. So these are all things that comes under well-being. You should be able to assess and tell if a patient is going through any form of abuse or by engaging them. You will tell if you see any changes in their behavior, what we call behavioral traits. You will need to sort of bring to attention or judge them and inform or pass over to your next carer or colleague at work. Okay, so these are all domestic abuse, social care. By looking into their care plans, you can tell the environment where they sleep. Is it well organized? Is it looking good? Is it a place that raises concerns? Okay, so these are all things that when we say well-being, we need to look into all the aspects of issues that comes under well-being. Treat them with respect and dignity, making sure when you are bathing, they are well covered, they are not exposed to nakedness, and these are all what we call well-being. Okay, now then we have to look into keep people healthy. Okay, it all forms under well-being. I've just mentioned it. The healthiness of people is all well-being. It's part of the duties of a carer to understand some of these things, that they are healthy, they are eating well, and all that. Okay, now it also involves people in their own health and care. Yes, you are given a chance to involved in their healthcare and what matters to them. And therefore, you have to make sure that you are complying with their person-centered care. They have a choice. The patients have the choice. The service users have choices. And you have to ensure that their choices are factored in when you are taking care of them. The choices are very key. Making sure that whatever you're doing, they have a consent. And if for any reason they decline to what is best practices, you cannot force them. You need to just write or put some notes reason why a patient have declined in. For example, if a patient declines to take medication, you cannot force them. All you need to do is draw the attention of the team, write it down in your communication book, and then leave it like that. Okay? Are we together? Are we together?
Yes.
Do you have any questions?
Yes, we are.
Do we have any questions?
For me, no.
No.
I've asked that if we have any questions at all. Hello, team. Hello.
Hi.
I've asked, do we have any questions? Oh, we have more people have joined, isn't it? Those who have just joined whilst I was lecturing, could you put out your full names for me? Okay.
Oluwafunmilola. My name is Oluwafunmilola.
Hello.
Hello.
Could you write your full names on the message group for me, please?
Okay.
Uzma. Uzma,
Yes.
can I have your full name, please, on the message group for me? And then I'll need your video turned on briefly.
I won't be able to turn on my video now. Sorry. My name, I already sent you my full name.
Is it Temitope?
Yes, this is Temitope.
Tell me, please, have you put in your full name already?
No, not yet, please.
Could you do that for me, please?
All right.
Well, yes, that's part of the rules. We need to have attendance. So please.
Okay.
All right. So once you've done that, then we can crack on.
Yeah, I've done that.
That's fine. That's fine. So we can crack on. I've asked, do we have any questions?
And I've put on my name.
Can we unmute ourselves? There's so much feedback coming from our background. I don't know those who have not muted themselves, please. Look, I've asked at this stage, do we have any questions at all? Okay, we can crack on then. All right. Let's see how many people now have turned their names on. Emmanuel Abu, can
Yes,
I?
sir.
Okay, for me, you've just sent a message. Is it for me? No
No,
number.
you're asking if I have if there's a question. I said for me, no, no question from me.
Say it again, Emmanuel.
I don't have a question. That's why I said for me, no. You asked if there's a question. I said for me, no, no question.
Okay, okay. But have you put in your full name already?
Yes, my sister Emmanuel Abu. Ahead of Temitope Esther Akiyele.
Okay, that's fine. So I did mention as part of my earlier summation that one of the components within the health and social care structure is what we call personalized care or support. Please, if a child is crying, and who is that, please? Okay, as part of the structure within the health and social care, I did mention one of the key components within that care is what we call personalized care or support planning. It's very important that you as a support worker or a carer, you need to do what we call a systemic approach in personalized care or what we call person-centered care. It in anything, even question interviews and all that, it is important that you understand that the patient comes first before any other thing. Okay, and so you have to practice what we call person-centered care or personality care. What it means is that you are adhering to the choices and the wishes of the patients rather than the system, what you have been paying through. So in other words, when the patient refuses to eat, it is important that the patient will have to eat because they are in the recovering process. They will have to eat so they can sort of administer medication. But if they refuse to eat, you cannot force them. You can only, they have a choice. It's their personal distance. You can only sort of write the notes down why they have refused and inform your line manager. And that's what we call person-centered care. It's very, very important that you guys understand this. Okay. In well-being of people, you also share decision-making informations where people may experience a change in their health work together with clinicians. So the information share, you share information between yourself and your colleague, between your line manager, between nurses. Sometimes you have to call GPs, sometimes you have to call nurse of kin. So there are information sharing in the health and social care sector. And for that matter, a carer should understand this and all that. Self-management gives you the range of approaches to aim to enable people living with long-term conditions to manage their own health effect. Exactly, like I did said, all you are seeking to do, all you are being brought in is to just help them to become independent. So in helping them to be independent, you have to ensure that they are able to self-manage themselves. Of course, there are so many times where people could not manage themselves, and they need maximum support or maximum care to be given by the carer and all that. Even with that, you have to ensure that you are giving consent to what you are doing so that you don't find yourself liable or paperable in terms of whether or not you are doing the right thing, and then you are making sure that the service user or the patient is involved in the care that you are giving to them. Okay, supporting them in their needs and medical. I've mentioned that you are there to support them. You are there to ensure that their needs are met in different ways. Person-centered care, in the cleaning of the accommodation and all that. That is under social care. If it's the hospital, you are making sure that their beds are clean and tidy. At times, you have to lay their beds for them. Making sure that water is available for dehydrations and all that. So these are all things where you are clinically trained as a carer. Some of them are able to take blood, and some of them are able to give thermometer, what we call observations. You can do thermometer checks and do different kind of pulse, and able to tell their situation at any time and inform the nurse if it raises concern. So there are different ways and all that. And care and support needs assessment. The assessment, you may have your caring assessment that you can do. And so when you're able to do the assessment, you can or then pass on to a nurse to tell the nurse that, listen, I can tell that and this patient is not feeling well. Per the assessment that I've done, it could be thermometer assessment to tell the temperature, whether high or low. It could be pulse, checking the heartbeat and checking if the beats are. Please, can we minimize the noise, please? Okay. And so these are things that we need to look into. Okay. Then we could look into developing your health and social care plan. Okay, these are individual or personalized care plan that will lay out how you support and care needs. And so if I say care plan, what is the meaning? What those of you who are carers, what's the meaning of a care plan, please?
Care plan means how a patient or a service user is meant to be taken care of. What you need to know about the service user in terms of the feeding, in terms of the medication, and so many other things. Thank you.
Beautiful. Who spoke, please?
Omolola Odunuga.
Omolola. Okay. Well done. Well done. Does anybody want to add something to it?
Yeah, I want to add Emmanuel Abdul. I want to add.
Is that Emmanuel?
Yes, Emmanuel.
Emmanuel, you're a bit far from there. If you can speak a bit clearly, please.
Yeah, it's Emmanuel. Can you hear me now?
Yeah, it's better. Yeah.
Okay. So a care plan is a written document that has the consent of the service user that we want to care for, that contains everything we are supposed to do, the care that we're supposed to carry out, or the care activity we're supposed to carry out for that particular service user with the consent of the service user. So, in other words, it's a written document with the consent of the service user that contains every care activities we're supposed to carry out on the particular service user.
Amazing. Both Damanila and Emmanuel, awesome submission. And Emmanuel, you brought something to your submission which is key, and it said everything. I like that. Everything. In other words, everything that we will need to know about the patient that we're taking care of, whether in the hospital, whether in their homes as domiciliary care or supported living, everything you can get it from the care plan. So if you want to know about your patient, to be able to give the patient a better care, or to make sure that you become the best carer for the patient or service user, is the care plan. You need to have time once you report in your workplace for the first time, go through the care plan. Okay. In addition to the handover notes that have been given to you, go through your care plan. Okay. You have everything, what they like and what they don't like. Don't do anything that will irritate them. If they don't watch like TVs, don't turn TV on. Because if you turn TV on, you irritate them and you'll be reported for that. Okay. So everything that they don't like, you do that. What they don't, what time they wake up in the morning, it will be captured in there. What food they like, it will be captured. Sometimes how to prepare it, it will be captured in there. Their next of kin, who to call in terms of emergency and crisis, it will be captured in there. So every single thing, you have it on the care plan. The risk assessment that was taken, how do you have to transport them? Is it through Zimmer frame? Is it through two people who have to hold them? And if two people have to hold them, there will be provisions for that. If you have to hoist them onto their bed, if they are bed bounds, from bed to the accommodation and to the toilet area, if it needs two people, you need one person, every single thing we capture there. Are we okay? Right. So this is what we call care plan. Is somebody speaking at the background, please? Can we unmute ourselves, please? All right. And so it's well explained by Emmanuel and the other colleague, and it tells you everything. I've added to it that everything that you want, will be captured in the care plan. No, so the care plan, the care needs identified in your assessment, how your local authority intends to meet your care needs, your personal budget, and all that. Now, what it means is in the care plan, because there will be a social carer would have been already visited and done assessment in the home of the service user, it helps in authenticating the funding that will be available for the carer, and that is not your responsibility. But then it tells you the budget that will be allocated, and so if somebody is ill and it demands that he has to be transported from the hospital into their home for you to be care for, they will need a care agency to provide carers for them. They will need sometimes nurses to call on them. It might be local district nurses to call on them. And all these things will fall part of the person's pension or money available, what we call funding available to take care of them. Because if the person don't have enough funding and it demands 3 carers or to what we call 24-hour care, people coming morning, afternoon to care for them, it becomes a problem. And so the social worker, their duty is to make sure we have enough funding available to be able to make sure that the needs of the persons are met. Okay. So this is what we call developing your health and social care plan. Okay. And in personal care, what we seek to do is, like I've explained earlier, now I'm going to move very fast. It says you encourage and support people to live in event. That's what we do. You have much control over your life as possible. We omitted ourselves, please, to participate in society as equal, to have access to employment, family life, ensure you have the best possible quality of life, and then ensure you have dignity and self-respect. That is very key. Dignity and self-respect. If you don't practice dignity and self-respect, you can lose your job, because no matter the ailment of the person, even if it's mental health or learning disability, they still have the right or to self-respect. So if you are a carer who have been assigned to a patient and you feel that a patient has mental health conditions and cannot do, they still have self-respect. You need to seek consent. You need to speak. You have to give examples. Billy, can I take a Billy, can I turn you? Billy, can I put the towel around you? You need, even if they can, you have to communicate. Billy, we are sorry, we have to turn you to clean you. Where he's naked, you put a towel around him. Even the bathroom, you have to transfer to the bathroom. You make sure the bath is covered, that nobody else sees the person. Dignity and self-respect is very key in care. Okay? All right. Then the current healthcare system within the NHS, I've mentioned that it apart from the primary care, social care, and tertiary care, the NHS England, for which the new government, the Labour government, have proposed that they're going to change the name from the NHS to what we call healthcare services. Okay. So the national healthcare consists of NHS England that many of us know. We also have what we call the NHS Scotland. We have the NHS Wales, and then we have NHS Ireland. Okay. These are all components part of the NHS, but then different jurisdictions have different names that they call it. And so we need to understand that. And what is the primary core of the NHS? The NHS plan promises more power and information for patients, more hospitals and beds. And you realize that in recent years, for the past 2 years, there's been a struggle within the blood pressure with the NHS where they lack nurses and support workers. Hence why there was the introduction of the health tier 2 healthcare visas to allow foreigners to come into the country and to sort of help within the shortage within the health and social care and also within the NHS. Okay, so there have been a lot of and issues surrounding the NHS where people have to wait longer in A&E. You know, I, for instance, don't like going to the A&E because of the long wait. You know, I have to wait myself and my family if there's somebody's ill. It's not the best because they don't have enough staffs, nurses and all that to meet. And so those are some of the shortfalls when it comes to the NHS. But then its plans is to get more beds and get more doctors and nurses available to meet patients, and even especially older patients, people who are getting more older than the frequent attentions and all that. Okay, right now one of the key components is the Common Fund report on the 5 areas of performance within the NHS. Okay, the NHS, one of the areas performance we look at is quality. Is there any quality services being provided by the NHS? Is there any efficiency provided? You know, access to care. Are we getting access to care easily? And then, is there any fair equity amongst equality and diversity? Are they all inclusive? And then lastly, the healthy lives. As the NHS meeting healthy lives of the citizenry. Okay, it's very, very important. Now, the UK performed well when it came to quality of care and access to care. The UK also ranked first in efficiency, which was measured by examining total national GDP growth, you know, global domestic growth, you know, and to ensure that a proper amount of in the healthcare insurance sector. Very, very important. We need to understand. So UK did well when it comes to the healthcare sector and all that. But the healthcare in the UK kingdom was a devolved matter, meaning England and Northern Ireland, Scotland and Wales each have their own systems of private and public funded care. Yes, of course. Well, we need to understand that the NHS serves as the first point of contact for every. Hello, somebody speaking. Hello. Okay, so the NHS is an. Hello, is somebody speaking? Can we unmute ourselves, please?
Do you mean we should unmute or we should mute ourselves?
Mute, yes. There's somebody who has a child and it's not right at all.
Yes, I think you can please do that from your hand. Maybe you should mute the fellow from your hand so it stops distraction.
I've done that severally, but I don't know. All right, can you guys hear me?
Clearly, we can hear you.
Okay, that's fine. Okay. So a minute. So let's look into the healthcare system in different regions of the UK. As I clearly underscored, there are 2 functions within the healthcare in terms of the healthcare provision. One is the public funding, which for anybody who has right to stay in the UK will definitely have to enjoy those. And that's what we know, the NHS, free funding for every single person who have what it takes. And even if you have no recourse to funds, you still have some level of support that you get from government. But there's also what we call the private healthcare, where it is optional to a private citizen, whether or not you feel that you would want to take an additional private care, you are entitled to do so. And if you feel that you have some ailment and you feel that you have the money to pay for a private healthcare provision, you can do that as well. The same way when you have your pension and the standard or government pension, that it is mandated that employers pay for you. You can also have what we call your private pension, and where you can pay differently for that. So that's what it means, or when it comes to the different healthcare system within the country, and it's open to a permanent or what we call indefinite leave to remain, or British citizens, or even non-British citizens. Even if you are here, you have no recourse to funds, you can still do that. Okay. All right. Okay. And so we could also, so you say the most healthcare in England is provided by the NHS England public fund healthcare system, which I've already explained. Social care services are shared responsibility between the local NHS and local government directorate. What it means is, whilst is what we call this decentralized, whilst the funding, NHS funding is with the NHS England, and that seeks to cut across the entire UK. But when it comes to social care services, the funding of social care comes from the local council. Okay, it comes from the local fund, so it's decentralized. Whilst the NHS funding is centralized across board, across every hospital and across every GP and all that, when it comes to social care services, it's decentralized, have to do from the council. So there's a bit of allocations of funds from the local council where you find yourself, whether Manchester City Council, whether London Borough Council, name them. And so it means that there's always intermediary discussion between the local NHS and the local government, which is the council. So they are the ones that ensures that if a person needs some sort of support from their homes and for the accommodation that they live in, then this is what we call a social worker will be sent out to do what we call an assessment of the family and children, or of the sick person at home, to sort of mitigate and ensure that the person do have what it takes to exploit those funding and to put in the right methodologies and the right healthcare provisions in place. And that is when they will need agency company to supply carers for them, whether 24-hour carers or whether it needs complex care. Complex care means that person may need stomach treatment or peg treatment and all that. Okay, this is what it means when it comes to social care services within the local NHS. Okay, and then the healthcare in Kenya is publicly funded, generally paid by taxation. So the reason why we don't pay for the NHS services is because in our salary, the component part is tax. So everybody's tax, there's a taxation, whether tax, and then your NI deductions. Those are what goes into government support and providing funding for us, whether the road transport, think of our roads, and one of it is the healthcare. So whatever you are enjoying is something that you are paying for. Okay, all right. Then it's also very important that you cannot be denied access to these things because you are paying for. So there cannot be, you have what we call in the European Convention, you have what we call Article 7, Article 8, the right to family life, the right to privacy, and the right to health care. Okay, you have the right to enjoy these things free of charge as a citizen, whether you're a British citizen or non-British citizen. You need to enjoy those facilities. Okay, however, rural communities often find difficult, of course, in accessing those who live in very far in the farmlands and all that, because they have to travel a bit far to be able to get the nearest hospital or the nearest GP and all that. They struggle in those, and so there's a different kind of strategy in helping them. The Department of Health is responsible for improving the health and well-being of the people of England. While the NHS primary care trusts have been established to improve the health of their local population, to work jointly with a wide range of partner agencies to commission hospital and commission services. Then we have what we call strategic health authorities. The goal of these authorities includes ensuring that national priorities for health are integrated into local plans and strategies, building the capacity of health services, and ensuring that high quality performances are found within the NHS. Okay, and so in urban areas, you might find a bit easier, but with the rural areas, there's different organizations that will be set to meet up. One of them is a countryside agency that have a mission of making life better for people in the countryside. Yes, countryside, because those who live in those farmlands areas, those who are rearing and far from cities and all that, it's quite difficult for them to reach out to hospitals and all that. So there's a different agency that seeks to help people that live outskirts of town. Okay. Right. So it's very important that we take note of some of these things. Right. Thank you. Legislations and self-regulation. Obviously, we know the Health and Social Care 2012, okay, which was introduced to as first legal duties to about health and social care inequalities. It's included specific duties for health bodies, including Partner Health, Public Health England, clinical commission groups, NHS England, which require the bodies to have a due record to reducing health inequalities between the people of England. The Act also brought in changes for local authorities in public health function. I've just explained that local authorities, then we're talking about the council, we're talking about the social care amenity that is provided. Okay. Then we also know that we cannot talk about the Health and Social Care Act 2012, which is a key component of the health and social care sector. Once we mention that, then we have to talk about Equality Act 2010, okay, where we talk about sexuality, people's age, and we have to make sure that the 7 components of equality are met. Okay, so the equality established duties of public sector bodies which aim to integrate consideration of advancement of equality into day-to-day business of all bodies aspects of their duty. It's very important that Equality Act is met within the Health and Social Care. Social Value Act 2024 requires public sector commissioners, including local authorities and healthcare bodies, to consider economic, social, and environmental well-being in procurement of services and contracts. Social care, I've mentioned, is more to do with the local authorities, where the health and social care is quite broader, okay, aspect of the health and social care industry. Okay. Now, it is important that we look into the Health and Safety Work 1974. Okay, what we call HENSOL. Now, the Health and Safety Act 1974 falls under the Health and Social Care Act, where because it is important that the health and safety becomes a paramount key component for employers and also the employees. It is important that you ensure that the premises where you're working are safe, and the ultimate priority and responsibility is the employer who is employing you to make sure that the place is safe, clean, and tidy of any injuries and situation that may cause any harm and danger for any employer or employee. But notwithstanding that, the employee also have a duty to make sure herself is protected, and then making sure that he's complying with any rules and regulations or any health and safety policy that you may have in your care home, hospital, or wherever you're taking care of the person. Okay, very, very important. And it's called the Health and Safety Act 1974. It's also very important what we call COSH, Control of Substance Hazardous to Health Regulation. And this involves, most times you might not see that much in your care home, but in the hospital you may see that, putting on gloves And aprons are all factors under controlled substances, okay? Because there are substances that you have to hold, and you cannot hold it by your bare hands. You need to put on gloves. In fact, even changing personal care, you have to change patients and all that. It is important that because you might touch certain things, urine and all that, which is not safe for the hand to hold. So you need to put on aprons and all that. And so not necessarily hazardous products, but then there are products also that are very chemical in nature, and you need to have yourself well protected to be able to hold those things or work with those things that may cause harm and ailment to you, the patient, or when you are exposed to, it can cause ailment to you. Okay, are we together? Okay, then we can look into reporting of injuries, diseases, and dangers, what we call radar. Okay, and when issues happen in your workplace and the hospital, there are ways of reporting. Okay, so reporting accidents and incidents is an important part of your work in the health and social care workplace. Very, very important. Even there's a call, what we call near miss. How many of you know what the meaning of near miss? Do you know the meaning of near miss?
Like a mistake.
Like a what, please?
Mistake.
Okay, well, not really mistake, but a near miss
Almost.
is
It's almost
almost.
happening. It has
Thank
not
you.
Like
happened.
Thank you. Thank you. Thank you. And so, Emmanuel, that's what it means. It almost happened. It's called near miss. The fact that it didn't happen, and you need to also report that. Are we together? Okay. Yes, you need to. So near miss are incidents or accident that nearly happened, but it didn't happen. Okay, it nearly happened. So you need to record. The law mandates you that all needs to be reported. Okay, either in most care homes or supposedly you have what we call accident or incident book, don't you? So those book, you need to record every single thing. Okay, somebody fell down, the patient fell down by mistake of yours or not yours, or patient himself or herself. All those need to go into records of your incident books. Very, very important. Okay. Okay, then fire safety order 2025. We all know, very, very important. For any care home, anywhere you work, one of the first thing they do is give you orientation, don't they? And then make sure they show you the fire exit point. Very, very, very important. Okay, they sound alarm to understand when there's the announce sounds 3 times, it means there's potential fire outbreak, isn't it? Or there's a concern. So when you work in a place and you hear and your fire siren sounding 3 times, what does it mean? What does it mean? When the siren sound 3 times, it's a sign of warning, isn't it?
yeah, so you need to evacuate
You have
the
to
building
evacuate. Thank you.
with the individual to support him.
Thank you. And so once you hear it 3 times, 3 continuing times, in which is a warning that everybody would have to move out to the nearest mastered area, that you would have been told when there's a fire outbreak, everybody have to move out to that place. So once it sounds to it, it's a warning. Sometimes employers do that as a way of testing, checking if people are complying. There may not be any issue, but they want to know that if you hear this sound, if you are going to move out to the nearest place. Okay, so it's very important that you get yourself oriented. That's why when you have an orientation, you have to listen to exactly what you are being told at your first place. So it's very important. It's the duty of the employer and not you to make sure that they have given you that education orientation when you go to a place for the first time, whether care home, whether hospital, or even in a supported living facility. There should be some kind of education as to when there's a fire outbreak, where you have to go, where there's a fire extinguishers and all that. Fire exit points, very, very, very important. Okay. Now, having said that, expenditure in the UK, that is not key important, but then we have to realize that in 2020 there are about 1,840,000 people employed by business in health and social care sectors, United Kingdom, with about 474,000 people employed in business that employs 5 and 8. It tells you that there's always increase in employment within the healthcare sector. Always. It hasn't declined. Okay, and the gross domestic product is always increasing. Okay. In 1997, it increased to about 6.8%. In 2019, there's huge increase to about 10.2% of GDP growth. Okay, it's massive, and it's been increasing every now and then. Okay, every now and then there's increase in the employment sector within the healthcare, and so it's an area that people will need to have a keen, careful in observing and making sure that you learn to the tenants of the industry so that you don't fall yourself into issues that may lead into having issue onto your DBS, and making sure that you don't have any issue that will cause you not to practice within the sector anymore. Okay. Now, I've already mentioned about state funding and private fundings and all that. I've mentioned that. I've explained that to you, why it is very important. And there are NHS charities as well that we need to know about. Okay, so there are charities that help the NHS in terms of funding. In other words, what they say that they support or they help with funding when it comes to the NHS. I remember during the COVID-19 when a lot of nurses were helping the people who were dying and all. There were so many charity organizations that was helping the NHS. Okay, people were even providing food in the hospitals free of charge to nurses, because nurses, some of them could not come out because of the COVID-19, and they were working within. And so many charity organizations, restaurants, food, they were providing food to the hospitals free of charge to help nurses, and appreciating them, nurses and carers, I beg your pardon, and nurses and carers providing food for them. In fact, there were huge rate of salary that was given to carers and nurses who were who have taken time off to take care of the patients who were dying and all that. So it's very important that we take note that there are charity organizations that help the NHS as well in terms of their funding. Okay. Regulation in health and social care. Yes, regulation plays a major role in health and social care. One of those is care insurance coverage. I've mentioned that there are insurances that people can take as an additional cover privately to help them in their care when you say. Now, we cannot talk about the regulatory part of healthcare without talking about CQC. Now, if you aim to establish a company in future, one of the ways is getting yourself aligned with the CQC, which is the Care Quality Commission, established in 2029. And what they seek to do is to ensure that care agencies, care home hospitals complying to healthcare provisions. They are the duty regulatory organizations that come into your care home office and all that to make sure that whatever you are doing is complying with the national policy and regulatory body of the healthcare industry. Okay. In other words, they have what it takes to inspect and then advise whether your care home should be closed, or whether the hospital should be closed, or supported living facility should be closed because you are not. So they protect and promote health and safety and welfare of people who use health and social care. So they protect the patients and also protect the workers as well. Okay. And that is why if you're already a carer, anytime there's going to be a CQC visit, you realize that your managers would always be very straight and making sure that you guys are doing things very well, because they don't want themselves founding, and the CQC have the right to advise that they would have to advise the place to be closed, that if they are not practicing a good practice or good best practices in making sure that the patients are being taken care of, the place is very safe, then the CQC have the right to advise that it's a poor managed place and they can be closed down. Okay. All right. The CQC helps improvement of health and social care services, provision of health and social care services in a way that focuses on the needs and experience of people who use those services, and then efficient uses of resources, and the provision of health and social care services. Okay. All right. And they are also other regulated bodies. Okay. Now, so CQC is the mother organization, even in those who have come through tier 2 visas and all that. You realize that people have come through their sponsors, and over time they said the sponsors cannot practice anymore. They have to withdraw their licenses and all that, because CQC can advise that, to the Home Office when they visit your office, and your the way you handle your staffs is not the best in terms of best practices, making sure that you are doing the right thing. CQC can advise the Home Office. They can shut you down, and the Home Office would have to withdraw your license. So they are very powerful in the UK. So if you go online, you normally check, you will see CQC performances for every agency. It says excellent, good, or bad. Once it says very poor, it means that you need to map up your game. And if it's not helping, then CQC can advise that your company should be closed down or your care home should be closed down. It's very, very important. Other regulatory bodies, the General Chiropractic Council, that regulates chiropractors, and General Dental Council, GDC, that regulates dentists and dental therapists. The GMC, which is also the same in Africa, General Medical Council, that regulates doctors. We have the General Optical Council that regulates opticians. We have nursing and midwifery, we all know that regulate nurses and all that. And then we have the ACPC, which is called the Health Care and Provision Council, that regulates radiography, scanners, and all those professions as well. It's very important that we know these things, okay? We have the General Pharmaceutical Council that regulates pharmacists, okay? The Northern Ireland Social Care that regulates workforce within the Northern sector. Social Care Wales that regulates the social care workforce within the Wales environment. And then the Scottish area, we have the SSSC, that Scottish Social Services Council, that regulates the work for social services within the Scottish environment. Okay. And then we have the Northern Ireland Social Care that regulates the workforce within the Northern Ireland Social Care Wales we have done, and then the other. And we can look into regulatory and monitoring. So like I did mention, CQC regulate, but they also monitor. So I think for every 2 years or every year or so, CQC would have a place that they will visit the care home and monitor and ensure that the care home or the hospital are doing what is right in law in terms of patient safety and all that. And so they monitor and they regulate and they also monitor, and then they will give a final judgment about your care home as well. Okay. Public spending on health and social care. Of course, the government is spending so much within the public sector in health and social care, and there's much pressure on the government in ensuring the budget deficit is not huge. Okay, it's not huge at all, and so they will have to increase the funding in 2021 to 150.4 billion in 2020, and they still have to increase it as well. It includes more 60 billion for extra funding for Department of Health and Social Care 2020-2021 response to the COVID-19 pandemic, which included procuring personal protective. We all know that there were huge sum of funding that was increased, and even to date, okay, it is not enough. Okay, the NHS need much funding to be able to meet, because a lot of people have come into the UK, and that is why they are cutting off immigration, and the workforce. Okay, there's a lot of people who have been here, and so there's high demand of people that are using the NHS, and it's only few people. The funding is not enough to be able to meet. So there's a need. Public purse have to be increased because people have come into the UK from Europe, from refugees who are coming through different borders and all that, and from even back home Africans who have come here through healthcare visas and all that. There's huge number of people on the NHS framework, and there must be a different way of dealing with issues, and the budgets need to be increased. Okay, that's what it means. Okay, recent changes of funding during the period of austerity, the economic crash, the Department of Health and Social Care budget continued to grow, but a slower pace than in previous years. Budgets rose by 1.4% each year on average. This outcome every year. There's budget increase about 1.4 every year that goes on to the NHS England as well. Okay, the NHS had a 5-year funding deal. In July 2018, the Prime Minister announced a new 5-year funding deal that would see the NHS funding rise by 33.9 billion in each case, each terms 22-24 compared to 2018. So what it means is that over time, there's always a long-term funding deal have to be in place, because the NHS or the Department of Health and Social Care budget as capital investment, public health, and education training is always increasing, because the number of people who are getting older within UK is increasing every now and then. Okay, so the aging population is huge, and therefore the funding to available is not massive, and it needs a review. And so if you are being asked to look into what are some recommendations that these are some of the things you can mention that we can recommend, that there should be a review into the funding, or the workforce within the NHS. Okay. manifesto of the Convention on COVID-19 is not too much important to us. COVID-19 manifesto that happened, I've already mentioned that to us and all that. And then in analyzing the health and social care spending in your choosing country, okay, and for that matter, UK should be your choosing country, okay, and not Nigeria or Ghana. So in analyzing that, I've clearly stated that there was a massive increase in 2021 through fiscal events, including spring budget 2020, a plan for jobs, spending review 2020, and March budget 2021. Additional funding has been provided to support the health service response and recovery from COVID-19. Because of these changes, the Department of Health and Social Care budget between 2021 and 2022 will be much larger than original plan. Of course, we all know that. Over 20 billion of extra COVID-19 related funding has already been allocated to the Department of Health for 2021-2022, and more funding is likely to be needed as a cost of responding to pandemic, which we all know, the COVID-19. So that's not really important, but it tells you how many funding that will be made available over the years, because there's always issues along the line. And we are done for today's lecture. So what we have looked into in today's lectures is that we've looked into the aims of the health and social care provisions. Okay, we've also looked into the organization of health and social care provision within the UK. We've also looked into the size of the health and social care sector within the UK. We've looked into how the health and social care provision is funded within the UK. Okay, then we've looked into how the sector is regulated. We mentioned CQC, we mentioned regulatory bodies for professional bodies. Okay, where CQC regulates organizations and firms, they are regulated that regulate the professions themselves, nurses, doctors, pharmacists, opticians, and all that. Okay. And we've looked into the health and social care spending for the UK. Where the spending, we realized that over time has been increasing because of the budget deficit and then the COVID-19 that happened. And as I speak now, there's always increase in budget because quite a number of people have come into the UK, and the UK will have to increase their budget to meet the NHS and deficiency that will normally occurs. Okay. References, if you go into your student model, you can have all these references and then you can read more. It has the Health and Social Care Services Guide 2029. It has a care worker charity, one of the charities that help the NHS. Okay. You have the Health and Safety Act 2012. These are things you can read about. So all this information, you can get them on your model. Do we have any questions at all? Any questions? Hello?
No
Hi.
question.
We have no questions at all. Okay.
Hello, we're here.
Yes, so I've brought the meeting to an end. If we have no questions to ask, then I'm going to call off the meeting. If we have any questions, we can. I'm free also on the group, on the WhatsApp group. You can put questions there if you have, and you can message me privately if you need any help or any advice as well. Tomorrow we have a lecture, I think around 2 o'clock as well. So if there's no questions at all to be asked, then we would, ladies and gentlemen, I'll bring the meeting to an end. Am I good to do that?
Please, are we getting the recording?
Yes, you are.
Yes, you are going to get recordings.
All right, thank you.
All
Okay.
going to your student model.
All
Yeah,
right.
Thank you so much. I enjoyed this lecture.
Thank you so much. Can you put your review, your comments on the chat group for me, please?
Sorry, a quick one.
Okay.
Yeah, are we gonna do any assignment after this
Yes, by
lecture?
the end of, not this one, after unit 4, when we finish the final unit.
And that will be one place.
You should have gotten what do you call
Oh,
it?
yeah, I
Yes.
got it. I
Okay.
got it. Yeah,
Thank you.
that's all right.
Thank you.
All
Yeah,
right,
so
thank
not
you.
now. We have assignment discussion on the last lectures. I think we have about 2 or 3 lectures more to do. Once we've done the last lecture, after that, we have one more lecture, which is going to be assignment discussion lecture. When we have done that, then your assignment, you can finally start your assignment. However, for those of you who are in the healthcare industry and you feel you can start your assignment, you can start as well, because your student model should tell you your assignment task should be on. Okay. Are we together?
Yes,
Yes,
we are.
we have.
Okay. So what I'm saying that you have to wait. We have unit 1, unit 2, unit 3, and all that. Once you finish the unit, then you can have a better understanding of all the assignment, because the assignment is a broad. It's not only one unit, okay? Okay, you have unit 1 assignment, unit 2 assignment, unit 3 assignments. Okay. And so if, for instance, if you those of you who were here before I started, if you look at, I shared a document which has the unit assignments criteria. Okay, you should have it on your model as well. So if you want to start the assignment, you can start you can start per every unit. You have it on your student model. Okay, but then the assignment does not only cover unit 1. I hope you understand what I'm saying. It is going to cover
Yes,
unit
yes.
1, unit 2,
All
unit
the
3.
units, yes.
Exactly. So you can start unit 1 assignment, and as time goes on, you can add unit 2 to unit 3 to it and all that you can. But then if you want to have a full understanding of the whole, then probably you have to wait and have unit 2, unit 2, unit 3, so you can have a full understanding. But nothing stops you from starting your assignment. But you can only start unit 1 assignment. You understand? Okay.
Yeah.
All right. So ladies and gentlemen, is that all? So leave, Emmanuel, everyone leave. If the lectures is so good for you, leave your comments on the chat room for me, okay?
I've done that already.
Okay. All right. Those who are there, we have 15 people now. Are we okay? I need responses. Are we okay? Can we end the lecture now?
Yes, we can.
Okay.
Yes, we can.
All right. Thank you, ladies and gentlemen. Thanks so much for your time. Okay.
Yeah, bye.
I'm on the group, so
Thank
anything,
you.
any information you need, any support, message me on the group, or you can probably message me as well. Okay.
All right.
All right. Take care. Take care. Bye-bye.
Bye.